It is located in central Kenya with about 12 sub-counties. Its main economic activity being agriculture and has a population of about 1.6 million people. Led by His Excellency the Governor, Honorable William Kabogo, the County of Kiambu brings you their well-being journey in the health sector since the inception of devolution in Kenya.
The management of healthcare is taken care of by what we call the 7 pillars of health. If you don't manage a pillar, then health collapses.
The first thing that we did when we came in is that we were able to organize the department by creating the organogram on how to create a working team that will be able to effectively deliver services to the people. And we were able to come up with our strategic plan 2014-2018. And this strategic plan was done under pillars of WHO health investment.
These pillars of health that make up the structure include infrastructure and equipment, service delivery, commodities, data, finance, leadership and management, human resource, and public-private partnerships. Dr. Stephen Juguna, the Kiambu County's Chief Officer of Health Services, takes us through the different pillars.
The 7 pillars of health include what we call infrastructure and equipment. We are continuing to refurbish and rehabilitate infrastructure in this county. We'll be renovating about 50 facilities this financial year, having done 41 last financial year.
When we sat down, we realized that the infrastructure was inadequate across the county. And in Thika Level 5, we have invested heavily. His Excellency the Governor came and participated in our groundbreaking for a state-of-the-art reproductive health unit, which will house 270 beds in the reproductive health. We'll have a state-of-the-art maternity units. We'll have the state-of-the-art theaters, newborn units, inpatient and outpatient services.
This is the 4th or the 3rd month since we hit the ground running, and we are happy with the progress, and I'm hoping that by June this project will be, at least the construction will be over, and we shall be probably equipping this unit, and I'm happy that Kiambu is on the right track.
Kiambu Hospital started as a small dispensary for the people who were involved in the wars early in the 1920s. But with time, it has grown to a size of about 380 beds currently. We do have about between 450 to 500 staff of various categories. With this, we are seeing about 800 outpatients every day, and that is inclusive of adults and children. We are also conducting about 30 deliveries on average in a day. We do have operating facilities, but all this we want to upgrade to coincide with the current times and with the vision of our county to be among or be the best healthcare provider as a county in this country. We have quite a number of projects that are ongoing currently. The county government have embarked on a major facelift of the hospital. Right now we have embarked on renovating the outpatient department. We are going to paint the whole of the outpatient and the rest of the hospital. The hospital will have a new look, and we thank the county government through the Department of Health and the hospital management team for making sure that this happens.
The county has allocated us about 150 million, which is also going towards the new ward construction. And then we also have funds improving the facility, and that's about 1 million shillings. Our goal is to be a fully functional level 4 hospital. We also want to be the center of excellence for pediatrics. We want, when anybody hears Tigoni, they're thinking where it's the best place for you to bring your child. And in future, obviously, is to get to even the level of a level 5.
Early 2015, the national government launched a 38 billion shilling cancer and kidney treatment plan that would see at least 2 hospitals in each county fully equipped with the best state-of-the-art medical facility. This, in Kiambu County, is a move that has given birth to the advanced infrastructure development and renovation in various hospitals. The Kiambu County government, in collaboration with the national government, has seen most of their facilities equipped, with Kiambu and Thika as their main hospitals, and also the new Gatondo Hospital block, which is part of the Vision 2030 flagship projects, among others.
The county government is doing a lot in terms of supporting the hospital. We have already been earmarked as a center for non-communicable diseases. In teaching, the county government is refurbishing some of our old buildings, renovating them and making them ready for Kenya Medical Training College. The county government has also gone into an MOU with Kenyatta University, where we will have some working relationship to elevate the services to wananchi through cooperation in the teaching university. We've also been working with Aga Khan University and Jomo Kenyatta University. There is a project coming up to do with the sewer treatment, where instead of doing the sewer the normal way, of taking all the sewer and putting it into a septic tank, then you follow it further with something called biodigester. And the biggest part is the recycling of the water, because with the recycled water, then we will be able to maintain a very clean compound.
We are at the moment when we are seeing a lot of infrastructural investments by the Kiambu County government. For the last 1 year, this hospital didn't have a theatre. The county government has given some funds, and the construction of this theatre is just about to be finished. We shall be able to be doing our operations light here, referrals will be reduced. They have also given us the covered walkway, so now patients can be able to walk without suffering the elements of the weather. Our hospital is also undergoing some good renovations. All the walls, the outside walls, are getting painted. They also understand the need for increasing the number of beds for Roiro Sub-District Hospital. There are plans to increase the capacity for this hospital to a very huge extent.
We have a new theatre, so guys don't have to trek all the way to Kiambu or to Thika. As a student, okay, I know the current issue in our county is employment. I'm a business student, but I know one development can lead to us getting jobs. For instance, I can start a business here, like for cooking even tea for the staff, because when they're employed, I'm sure I'll get a job, like I can come cook tea for them, you know.
Tuko na hospitali nzuri, matibabu tunapata vizuri. Hata kuna msichana nileta hapa kwa maternity ward, na hospitali yenyewe ni safi sana, na naona huduma inaendelea vizuri sana.
Mambo ya hospitali hii bila shaka tutajaribu ikuwe level 5 kwa miaka miwili inayokuja. Level 5 ni kumaanisha kutakuwa na kila kitu katika hospitali hii.
Indeed, we have also invested heavily on ensuring that we refurbish and renovate all departments within the hospital. There's a construction which is going on expansion of our laboratory and our dental department. We also did an expansion of our outpatient department, where we ensured we have refurbished sanitary facilities for both ladies and gents. So we have embarked very heavily. The project for the reproductive health units will cost us about 700 million. We have invested another 30 million for general rehabilitation of the hospital, including paving all the walkways, changing all the asbestos roofs, and indeed we'll end up doing a paintwork for the entire hospital. We as a Thika Level 5 hospital endeavor to become a center of excellence of reproductive health. But on top of just expediting or giving services on reproductive health, we boast of other specialized services, including surgical services, where we offer accident and trauma cases.
Nimesoma mambo mingi sana. Isipokuwa ni machine, hiyo msumali ingekaa tu kwa mguu. Juu walijaribu bila machine, hawakuipata. Na pia government ya Kiambu nimeipongezi. Juu hizi digital zinafanya kitu easy.
All patients who come with all sorts of ailment to do with surgery, we have an orthopedic surgeon who is able to expedite on that. We also have a pediatrician who is able to take care of all diseases which affect children. We have a pathologist who is able to assist in diagnosis of the various kind of ailments which come to us. We also, of course, have very specialized gynecologists who are able to ensure that the reproductive health is taken care of to the highest standards.
I came on Tuesday. I delivered on Wednesday via CS. They were very quick, even at the theater it was very quick.
On my side, the services are very good. There is a lot of improvement in nurses, cooperation, as in you can see they are cooperating with you every time. When you are in labor, they are checking on you. After you give birth, still they are checking on you.
Kwanza nilikuwa huko nikapimua mtoto, alikuwa amevunjika mkono, nikatumwa hapa. Hata ili sikupaga sana, nikaenda nikahudumiwa. Kuna wakati tulikuwa tunakaliswa sana, lakini siku hizi mambo imebadilika kabisa. Hata tunaendaka upesi.
Mtoto akija duniani hapa Kiambu atakuwa akija duniani kwa njia ya staili na starehe.
Other innovations that we have said that we'll do is having a blood center satellite unit that has been stationed and commissioned at Thika Level 5. This unit is collecting around 1,200 units of blood per month, and that's our target, and currently we are doing at 600, and we are hoping that we'll be able to empower that to collect more.
The Managed Equipment Services project provides each of the selected hospitals with modern theatre equipment, surgical and sterilization equipment, laboratory equipment, kidney dialysis equipment, ICU facilities, digital X-ray machines, ultrasound and imaging equipment. With the construction works in completion in the major hospitals, the county health management team has other works in the rest of the facilities. There is the renovation, expansion and construction of an outpatient department building in Gatwanyaga, Mbisi, Mutate, Anma, Tinganga, Kireita Forest, Kagwe, Kagaa, Gishoro, Dendero, Mushadha and Githongori dispensaries, Ngorongo, Juja Farm, Ngewa, Ngenda, and Githiga health centers. In Ndula Dispensary is the renovation of the fence, gate, and patient toilets and construction of a disposal pit. In Monyo Health Center is the renovation and expansion of the outpatient department building, fence, gate, and construction of a placenta pit. In Igegania Level 4 Hospital is the renovation of the maternity theatre and associated wards. In Karatu Level 4 Hospital is the renovation of the kitchen, laundry area, surgical theatre, walkways and the fence. In Mudhara Dispensary is the renovation of the outpatient department building, patient toilets, staff houses and construction of a septic tank. In Karifarifi Dispensary is the renovation of the outpatient department building, fence and the gate. In Lari and Lusigeti Level 4 hospitals is the construction of a surgical theatre.
We want to improve each and every pillar to ensure that service delivery is top-notch, that we enhance the kind of services that we give to mwananchi. Number one, we increase the services, and secondly, we enhance those services that we are having. We have commodities, for example, the pharmaceuticals and non-pharmaceuticals.
Many things are happening today that never happened in the last 50 years. We have medicine in all our 116 facilities available 24/7.
We have data for evidence-based decision making. Issues concerning HMIS, health management information systems. We shall have interconnected, we shall have digitalized and computerized all the level 4s, that is the 13, the level 5, that is thicker level 5, to ensure that they are now paperless and they are interconnected. Healthcare is about science, and science is about facts. Decisions must be made scientifically, and we must use information and data.
We have budgeted around 80 million to this financial year to purchase new medical equipment. We have realized that is not enough, and what we have said is that we'll go on the managed equipment services model, like we have been seen from the national government, where it is fully equipping Vika and Kiambu Hospital. So we have said the remaining hospitals will be able also to go under the MES component, and we can quickly be able to give all our hospitals medical equipment now, and we pay, the budgets are realized in the subsequent years.
And the most important one, we have the human resource, or the workforce, the healthcare workforce. This financial year, we want to ensure that all our healthcare workers, those ones who are due for promotion, those ones who are actually overdue for promotion, and those ones who are supposed to be promoted are promoted this financial year. The county has actually put aside 125 million shillings for promotions of healthcare workers, and we shall be promoting about 1,000 of our 2,400 healthcare workers.
We are engaged in this exercise of file Peluso for all the public health officers, other public officers who are working under the Kiambu County, the health department. And what we are doing, we are going through the files that previously have been with the national government, which was based in Afia House. So we requested all our officers to join us so they can be able to peruse through the file. That's why we're referring to it as a file peluso, for the purposes of us being able to come up with a database of specifically targeting issues to do with promotion. Because as you are aware that we've had issues of many of the officers stagnating in one particular job group for quite some time. And as a result of that, the county government has seen it wise that it can be able to engage the officers in going through the files.
Today I'm here for census and then to peruse the files, for file peruso. One thing I've realized, it is good for us. Most of the time you don't get time to go to the offices, to peruse your file, to find out what is in your file and what is not there. Today I found all my documents are there. All my applications are there. Each and every document is there. And I'm hoping in due time I'll be designated to orthopedic technologies. So I think the exercise is good. It's perfect.
I've been promoted once last year. That was in 2012. And I'm due for another promotion. I appreciate the kind of developments that are occurring in the hospitals at this moment. A key thing that I also give thumbs up for the county is the ambulance service that they have introduced. It's quite good. Number 3 thing is about the new diagnostic kits or tools, X-rays, machines that they have been brought. They are good.
The governor has actually ensured that all the works that are going on within the county government of Kiambu, 70%, a minimum of 70% are being done by the residents of Kiambu County. Now most of these persons are actually the youth. If you look at the projects that are ongoing, the kind of labor that is being provided by the youth of this county. This is because unemployment is one of the issues that we need to tackle.
Kazi hii vile ninaiona imenifaidi kwa kiwango kubwa. Kwanza tunaipata pesa ambayo inatusaidia kwa shughuli zangu, na vile sasa imejengwa, hasa sisi vile wakaji wa Kiambu tutakuwa tunateseka kuenda Nairobi, mara sasa tunaenda Kenyatta, tutapata huduma karibu sana na hakuna mambo yoyote ambayo tutakuwa tunatatazwa nayo.
Niĩ binafsi nĩ ndĩronera ciana mũtu no tuge nĩ kabogo nĩ ageretie tondũ nĩ ageretie gũtũcungira macirahi tondũ okorwo nĩ thibitarĩ ta ĩno rĩ tũthiaga kũnene mũno na tũtiarĩ na dispensary ya hakuhĩ rĩu ona tũrathiaga rĩngĩ rũthigĩtĩ rĩngĩ na gũkũ Ithaka kũndũ kũraihu.
So we say thank you Mr. Kabogo for a hospital. Health is wealth.
We are employing a number of healthcare workers, and we are not giving preference to Kiambu County residents, but we are encouraging them to apply.
I'm so excited. The interviews were free and fair, and among the 417 shortlisted guys, 50 were successful, and I'm among of them. Kiambu is leading in when it comes to health, and we have brought the new nurses that have been employed today. We have brought some new energy, and we'll deliver the best.
I'm happy to be employed by Kiambu County. I've been working with different hospitals and also non-governmental organizations. I have 3 years. So working for Kiambu County, which is one of the leading counties when it comes to health sector, is more of a privilege, and I'm feeling happy. Yeah, I'm thankful to the health management team and for the governor to give us jobs. Is quite something encouraging.
As we ensure that our hospitals are doing well, then you find that where there is a hospital, the area around the hospitals become empowered. For example, in all the areas where we want to expand hospitals, we have found new businesses coming in. We have leadership and management. All our hospitals have proper constituted boards that check the management of healthcare in every facility. Now, the boards are very important for us because they are the interface between the citizen and the management of the hospital. In fact, in Kiambu County, we have introduced an 8th pillar of health, and that is a partnership between the public sector and the private sector, including the NGOs.
The Kiambu County Government Health Strategic Plan not only cuts across the region, but also worldwide. The County Executive Committee Board member and Health Minister in charge, Dr. Jonah Mwangi, gives an insight on some of the networks established.
One of the key partners that we are working with is Mount Kenya University. As a partner, we have agreed to zone Thika Level 5 as a teaching and referral hospital. The other partner is Kenyatta University, which we have done an MOU that will be realized by making Gatundu Hospital fully teaching and an annex of Kenyatta University. And under that, we'll be able to come with innovations like on renal services, and we'll be able to work towards that. We have the University of Nairobi, which as a partner, we are working with CRISP to look at the issues of HIV treatment and HIV care in the county. And other areas that is key is maternal and child health. And we are confident to say that under CRISP program, we have been able to realize the dream of having a HIV-free generation.
PEPFAR is the large US government initiative to respond to the global HIV epidemic. Its main goal currently is to achieve an AIDS-free generation.
Githurai Lang'ata Health Center is a project at the heart of many in the region. Philips, a technology company, has worked with the county government and foreseen the successful renovation of the outpatient department building, the parking lot, maternity, and the perimeter wall. It has also seen the construction of the laundry area, commercial block, patient waiting bay, borehole and tanks, staff houses, and placenta pit.
The workload of the facility has increased tremendously from last year, June 23rd, because we've been doing workload of more than 150 patients to 200 a day as outpatient, and then at least 2 or 3 deliveries a day, whereby we go to about 60 to 55 or 40 to 55 deliveries a month. This is one facility which has been a pilot project with the solar system, and whereby we are happy because what we can say, it has really helped the community around Githurai, and it does not even look at Githurai alone, because we are getting patients from Mweki, Kimbo, and even Githurai 44 crossing over and coming to this side. And infrastructure-wise, we are doing good, because if it were not for Kiambu County government and the Department of Health, we would not be having a waiting bay whereby patients would be seen from, and also this equipment which help us to do the day-to-day running of the facility.
The other key partner that we have realized is Kidney Research Kenya. This is in realization that renal services as a non-communicable component is taking root in the Kiambu County, and very many patients are going to India and other countries for renal treatment, especially dialysis and transplantation.
We should be able to send people to learn on how to deal with the renal hospital, to go and learn there, so that when they come back, we should be able to deal with the renal healthcare efficiently.
We have continuously engaged the private partners, and we have quite a number of partnerships that we are doing. Of essence to mention today is the Kidney Research Kenya, where we have sponsored 4 doctors that will be going to Egypt and King's College London to train more on renal medicine.
We are striving hard to ensure that we are number 1, not in Kenya, but in Africa. We are not competing in Kenya, okay? So when you come to Kiambu County, we are not competing with other counties. We are not competing with the country. We are competing with Africa. And from Africa, then we shall now be competing with the world.
With most of the health achievements made and works in completion, the county government of Kiambu has a better vision for its people.
By the end of the next 3 years, Kenyans will be saying Kiambu is the place to go for medical tourism.